On today's video, I'm going to specifically talk to type 2 diabetics who need to lose weight, who need to get their blood sugars under control, who are tired of having their A1Cs out of range. That's who I'm talking to today. I've seen it over and over and over again. When we have those patients come in, specifically with our weight loss program, our genetic weight loss program, those patients do tremendously well. Why is that? I'm going to explain something to you. There's called insulin resistance and there's insulin sensitivity, okay? When somebody is younger, they're more what is called insulin sensitive, okay? And as they go through life, based off of choices and eating habits and things like that, they become more and more insulin resistant, okay? This ties into type 2 diabetics and weight gain, both specifically. The more and more insulin resistant you are, the harder and harder it is to lose weight, okay? Also, the more and more insulin resistant you are, the more likelihood that you're going to get type 2 diabetes or adult onset diabetes. All right. Why is that? There's a little hormone, you probably heard of it, it's called insulin. Not only is insulin directly involved with type 2 diabetics and not having the ability to produce enough insulin, but on top of that, on those that are struggling to lose weight, that same hormone doesn't work like it should. Okay, so I'm gonna take two examples. I'm gonna take a bodybuilder and I'm gonna take a type 2 diabetic. They could eat the exact same thing, and one is going to stay trim and lean, and one is going to gain weight. All right. Why is that? So those that are insulin sensitive, like a bodybuilder, that when they eat something that raises up their blood sugar, all right, insulin is effective. It's very effective at taking that blood sugar and shoving it into muscle and growing muscle. Okay. The opposite of that, unfortunately, if you're still listening to this video, is those who are type 2 diabetics or pre-diabetics, right? What happens with them is that blood sugar rises, same level, insulin goes up, and insulin now adaptively has done a very good job of taking that and storing it as fat, unfortunately. And so what we have to do is we have to figure out why is that happening? What's one of the best ways that we can figure out why that's happening and what to do about it? It's through an individual's own genetics. We can literally tap into their own genetics and we can find out exactly what their body needs in terms of fuel, in terms of food and drink, and it takes all the guessing out of it. So what do we see with these patients? We see them not only lose weight significantly, we see their blood sugars drop significant. In fact, I have to tell patients that within the first 2 to 3 weeks, many of our patients actually have to get their medications lowered down and reduced. What do we see after 60, 90 days when they go back and get their A1Cs tested? Dramatically different, dropped 1, 1.5, 2, even 2+ points in a 90-day time period. All naturally, just utilizing their diet and their genetics. So what I'm saying is that if you're suffering with type 2 diabetes, you're tired of just taking more and more meds, you're tired of the side effects of the meds, and you want to do something about it to not only help improve your diabetes situation, but also lose weight simultaneously, then I'm going to encourage you to reach out to our office. You can learn more about the program at fatlossburleson.com, but I'm going to have you specifically, I know on our website, there's an individual named Ricky Ingalls, and I want you to go listen to his story on our website about what he did. His story is basically the similar story I've heard hundreds and hundreds of times with other patients. So I want you to listen to his, and if you want those type of results, then give our office a call, get that appointment set up, and I'll be more than happy to meet with you, get you set up. We'll figure out what you need to do. We'll put a plan together, and we'll help you just like we helped Ricky and so many others. So anyway, hopefully this was useful, and I hope you have a wonderful day. I look forward to seeing you in the clinic. Have a great day.